Tonsillitis, acute tonsillitis, what is it actually? So it's a very common presentation whereby almost daily I see cases of acute tonsillitis. Tonsillitis is basically infection of the tonsillar cavity, its bed and its capsule. So tonsils is actually a lymphoid organ. It's situated in the oral cavity. If you ask a person to open the mouth, you probably can see their tonsils already. Everyone has this organ. So what purpose is this organ? Basically, before the age of 2, before the maturation of our white blood cells, which is like the soldier, the protective group of cells, targeting towards the enemies, the organisms, the virus, the bacteria and such. Tonsils serve a very important function to improve your immune system. It protects against organism entering through the oral cavity and causing infection. But beyond the age of 2, when your white blood cells matures, then it takes a back role, becomes obsolete. But then it tends to cause a problem because it gives rise to recurrent tonsillitis infection. Usually, tonsillitis is caused by virus. And as we know, any virus infection usually resolves within 5 to 7 days, with or without medication. But when is it serious? This viral infection, sometimes it becomes secondary infected with bacteria. Then it becomes more severe. So when it becomes more severe, when a person can't take orally, very painful, can't even swallow, then they become dehydrated, and the fever just keeps on spiking, then you need to come and see an ENT surgeon. You might need oral antibiotics, or in some cases where you can't take orally at all, then you need to get admitted. So this acute tonsillitis usually resolves with medication, but when it becomes recurrent meaning more than 3 episodes per year, then there is a definite role for surgical procedure, namely tonsillectomy. You have to remove the culprits because it's keep on causing an infection. For an example, a school-going kid, keeps on missing school, keeps on taking antibiotics, so much so every month requiring antibiotics for the same tonsillitis. Fever. The fever is so high grade, in some instances it causes a febrile fit. Imagine having an epileptic attack due to the fever, right? Dehydrated, toxic looking. So if this recurs 3 to 4 episodes per year, then you have to remove the culprits because it's keep on causing an infection. The other entity is chronic tonsillitis. Even without toxic symptoms, without fever, it's still causing you pain. Without acute symptoms, you're still in pain. So that too requires a surgical procedure whereby tonsillectomy to remove the source of your inflammation.